Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is December 7, 2021, and as always, this is your chance to get your COVID questions answered. We've been getting in lots of questions about Omicron variants, about our current increase in cases. So we will look at our dashboard. We will go over a number of slides, actually, to address a lot of the questions that have been coming, and then we'll take your questions live. Really pleased to be joined by a special guest today. This is Dr. Ali Sontag. She's a nurse practitioner with Chicago Public Schools. So welcome. Tell us just a little bit, and so folks know what kind of questions to ask, what your work has been like in this space.
Yeah, so as a nurse practitioner, I was originally hired to look at kind of care coordination for our students, and then COVID happened. So I've done everything from contact tracing, setting up our testing program, doing just kind of case supports, policy development. So I've done a variety of things in a COVID world. So anything COVID related, I'm happy to take questions on.
All right, perfect. And really, my team at the health department, we work with, as you know, folks across the city. We work with Chicago Public Schools, and we're really in almost daily conversations. But we're also in very, very frequent conversations with our private schools, our parochial schools, with the businesses. But obviously, CPS is one of our primary partners, and we work together a lot. So thank you for coming on, and we'll be able to take your questions directly. As always, we will start with our dashboard, chi.gov/COVID-. Let's pull that up. And what you see is some real increases, especially in cases here. We are now averaging 828 new COVID cases every day in Chicago. For those of you who have been following this closely, the Monday after Thanksgiving, we had more than 1,300 COVID cases diagnosed here in Chicago. And that was the most that we had seen since January of 2021. Some of that was because we had seen lower testing over the 4 days of the Thanksgiving weekend, not a surprise. But what we have continued to see is high COVID detection rates. So after seeing more than 1,300 on the Monday after Thanksgiving, we saw more than 1,000 each of the 2 days following that. And in that setting, we've seen this very significant increase, up back over 800 cases a day. Hospitalizations, Tuesdays is when those tend to get the most updated. We've not seen major increases there, which is good. 4 to 5 deaths a day still from COVID just in Chicago residents. Vaccinations are up a bit, doing more than 11,000 a day. We'd really like to see that, of course, even higher, especially including for boosters. We're testing very well, almost 25,000 a day, and in that setting, our positivity is 4.1%, up from 3.2% a week ago, still under the 5% that suggests we are adequately testing. So let me go ahead and pull up some of the data, and I'm going to show some, and then Ali, you can show some of the CPS data as well. And again, tried to pull some of this to get into a lot of the questions you were already having. So first of all, Omicron variant. This is what many of you have questions about. This was named a variant of concern on November 26th. That means it's in that intermediate level of concern. It's not just a variant of interest. It's not that we're interested in it. It's not yet been named a variant of high consequence, which would mean really a big deal if the vaccines were not working well, et cetera. It is still in the medium range there, that variant of concern. We're taking it very seriously. You can see on the map here, in the darker orange, these are all the countries that not only have detected Omicron, but know that there is local transmission, meaning that there has been spread already within that country. And then the lighter orange are countries that have detected Omicron in a traveler. At this point, they've not detected local transmission, but likely there has been some, and it is just a matter of time. So you can see in such a short amount of time how quickly we've seen spread. Similarly, across the US, the Omicron variant has already been detected in at least 19 states, and I absolutely expect that it will be detected in Chicago or Illinois even in the next day or two. Realistically, we are following multiple individuals who we know had exposures, whether they were traveling in the US or even internationally, and we have a pretty robust way to share information in a way that protects privacy but allows us to do case investigation and contact tracing, including over state boundaries. And so there are a number of individuals, including some here in Chicago, that we're waiting on some test results right now. As you know, the U.S. has restricted travel from 8 countries and also has tightened requirements for all international travelers. So there are 8 countries that right now, if non-citizens are not allowed to enter the U.S., those are all in Southern Africa, which is where we've seen the largest outbreaks. But also, all international travelers to the U.S. as of this week, no matter where they're coming from, have to get a COVID test within 1 day of travel to the U.S., regardless of vaccination status. There continues to be this recommendation for testing for COVID 3 to 5 days after arrival. And then for anyone who's traveling and non-vaccinated, which honestly is not very many people because most countries actually require proof of vaccination to travel at this point. But nevertheless, if someone were to be traveling, there's a self-quarantine recommendation. So what are we doing here in Chicago? Boy, have lots of you been sending in questions about that. So first of all, travelers. Any individuals who do arrive, again, this would really be citizens of the U.S., but anyone who is arriving from the 8 restricted countries that have Chicago as a final destination are being contacted to reinforce requirements. That's happening not just in Chicago, but across the country. We're working closely. IDPH is handling the outreach and communication, with the CDC to ensure that we know who folks are, that they know how to get in touch with the health department, that we make sure testing is happening quickly, and then if they do get tested for COVID, that we're looking for that variant as well. Secondly, as I mentioned, individuals who are known close contacts of out-of-state Omicron variant cases or even out of country here in Chicago have already been contacted, samples have been collected, and we have some test results pending. So again, I would not be surprised if we detect it even in the next day or 2. We also are in such a better place than we were prior to COVID in terms of our ability to do more of this advanced testing and sequencing. So Chicago has a relatively new, we didn't have this prior to COVID, but we've used federal funding to create we call RIPPLE, our Regional Innovative Public Health Laboratory. That's federal funding, partnership with CDPH, and then Rush University Medical Center is the academic laboratory partner. But we collect samples from across the city, people who are getting a positive test for COVID. There's additional testing, additional sort of genetic fingerprinting that can happen to look at that test to see, is this a variant? So with the emergence of Omicron, we have doubled the number of samples that are routinely being sequenced. We were working all weekend looking for variants from across the city. We've also added an additional preliminary testing step to speed it up. Other academic laboratories and hospitals outside of the public health infrastructure are also routinely doing some of that genetic sequencing and sharing it. And in addition to that more routine, what we call surveillance, which is looking for variants, looking for changes in the virus, whenever we're investigating outbreaks or unusual breakthrough cases or reinfection cases where we're seeing people get diagnosed with COVID a second time or even a third time, those are settings where we want to really get that genetic sequencing done. And we've been doing some of that. And then finally, as I talked about last week, we've been really growing wastewater sampling. That's another thing that we did not have any capacity here prior to COVID. And it's something I'm really excited about because it has the potential to be an important public health tool to really understand at a population level. It doesn't tell you who has COVID, but within a region of the city, a section of the jail, a portion of an airport, whether you are detecting something of concern. We eventually want to expand this kind of work to understand how, look at opioid use, for example, look at other viruses. So this is still growing, but the Discovery Partners Institute at UIC with many, many other partners, again, federal funding through a contract with CDPH, and we are working to get some primers in place. So for example, at O'Hare, where we're checking for some of this, we can be looking for the Omicron variant. And then finally, of course, our team is all over it, that when the first cases are detected, we'll be getting the information, focusing on travel, vaccination status, symptoms, outcomes, isolation, and close contacts. Especially the symptoms and outcomes is one of the areas we're still learning about. How severe is this? How much more transmissible is it? It's of course important to do what we can to limit spread here, but also to be collecting that kind of data systemically around the world to better be able to inform public health decisions. So this is just a little more detail. I think I've talked about this enough, but these are some more ways in which we are testing for variants, increasing our capacity, and I've been pleased. So and lots of you were asking, what are our next steps? What are we doing with Omicron? So we are extremely well placed to detect Omicron. We will. I am sure it is in Illinois, and I expect that we will detect it within, honestly, a day or two. The question is not, can we find Omicron? The question is, what is our response? So vaccinations remain the most important thing. If you're not vaccinated, we do expect that vaccinations will continue to have some protection, especially against the severe outcomes. We're still learning how much, and yes, we are still learning. Lots of you are asking, are we going to need an Omicron booster? We might. We'll know in another 2 weeks or so, once all the data has been collected related to how well not just has the vaccine been protecting around the world, but has the booster been protecting? How well has natural immunity, quote unquote, been protecting? Because we've been seeing a lot of folks who were kind of counting on prior infection getting infected again with this Omicron variant in other parts of the world. And so I don't have the answer yet of whether an Omicron booster will be needed, but what I do know is that getting the vaccines we have now and getting boosted has helped protect against the spread of Omicron in a number of case examples. All Chicagoans 18 and up should be getting a booster now. And if you're 6 months after Pfizer or Moderna or 2 months after J&J, please get a booster. We will be keeping the masks indoors right now. Obviously, cases are on the increase, and we'll be doing some more messaging around types of masks, giving you some guidance around that. The risk is higher right now. Staying home when you're sick. We did some investigations, including of, with this not unexpected post-Thanksgiving surge, we've had a number of situations linked to Thanksgiving gathering, not a surprise. But what my team is telling me when they're doing the case investigation is there were a number of situations where people went to Thanksgiving gatherings even though they were having some symptoms that they maybe thought were the cold. We even had examples of a couple of folks who had symptoms, had gone to get tested, but didn't have a result back yet, and gathered, and then we saw spread. Really important right now. Stay home if you're sick. Get a COVID test. We're working to increase that home testing availability. The health department has already been distributing some of those at-home tests in some of our hardest hit neighborhoods, especially areas where people may not have as much access to health care or funding to be able to buy it. At the federal level, these are going to be covered by insurance, and they're really ramping up production. So I keep these at-home tests at my house, and I use them if I'm having symptoms, if I, even the slightest bit of symptoms, if I'm going to be gathering with someone who is immune compromised or who I'm otherwise concerned about, and I encourage everybody to do that. Obviously, we're going to be, all the pieces of this help. Swiss cheese model, ventilation, hand washing distance, employer vaccination requirements. Certainly, many are coming due at the end of the year here. Might we begin requiring proof of vaccination for more activities in public spaces? Yes, I think we might. I certainly am more interested in that than I am in needing to, do some of the major shutdowns. And theaters and many other spaces have already been doing this, but it is certainly something that if, as this increase is continuing and perhaps with a new variant, we may do more of. Oral medications that work like Tamiflu that really cut the risk of severe outcomes if someone is infected. Those are coming really now and soon, and they're likely to be important. And then we're obviously watching our hospital capacity closely. Get a flu shot if you haven't. Flu is also starting to surge. For the travel advisory today, we do have 40 states and Washington, D.C. on the travel advisory in orange here. Minnesota, Wisconsin, and Michigan, unfortunately, are still among the highest rates in the country. We're seeing a lot of COVID from there. We did add Tennessee, North Carolina, and Washington, D.C. back onto the travel advisory. So again, this is only relevant for people who are not fully vaccinated. If you are not fully vaccinated, there are testing that you need to be doing before and after, and you need to be quarantining upon your return or visit to Chicago. Where we look at the Midwest here, things are not looking that great from a COVID perspective. This is, again, the winter surge as we move inside and we see more spread even before Omicron. Illinois is in purple here. You see we do have the lowest COVID rate per 100,000 population, and Chicago remains significantly below Illinois on average. But nevertheless, you can see that there's been some significant increase, just over the last month or so. And then above us, all of the Midwest states are on the increase. Michigan is on top here, Minnesota, but this is a regional with winter here and with a lot of people still not vaccinated. When we look at our community transmission and risk matrix, where we're over 800, we have moved into very high transmission in terms of our cases. That's the setting in which, yes, some of this is post-Thanksgiving, but nevertheless concerning. On the good news front, we are in such a better place from a testing access capacity, and with vaccine, we have managed to see some separation between the very high case rate and the hospitalization rate. So previously, before we had a vaccine, as you saw cases get into very high transmission, you saw our hospital capacity and our hospital and both non-ICU and ICU very quickly thereon following into the high and very high categories. And you saw our, us not necessarily be able to keep up with doing enough testing. Here at 4.1%, we've been able to keep in that lower risk. We're doing a good job of detecting COVID still. And then for the hospitals, you can see we're in this substantial risk, averaging 363 people in Chicago hospitals each day, not in the ICU, another 108 in the ICU with COVID. That's a lot, especially on top of other winter infections, but it's not getting up to that high or very high mark. So we're on the increase. You can see that's pretty sharp there in terms of that post-Thanksgiving increase. As I mentioned, actually more than 1,400 now cases from that Monday after Thanksgiving, but over 1,000 in the few days after that. And not a surprise, but still on the increase. Our positivity is still trending up. And then citywide vaccination rate, if you're looking at the whole city, we were getting some questions about that, so I wanted to clarify. When we talk about 5+, that means everybody who is eligible for a vaccine in the city of Chicago, anybody age 5 or over. 73% of the people who are eligible have gotten a first dose, and 66% have completed their series. And then if we go for those 12 up, that's where our Protect Chicago 77, we did cross ahead of schedule that more than 77, almost 78% now, have had a first dose, and 71% are fully vaccinated. If you look at adults, 18+, it's 78.4%, and then 65+, it's about 79%. So that continues to tick up. Obviously, with CPS and other schools and youth settings, we've had a lot of focus both on 12 to 17-year-olds and on our younger children, of course. I was at our city college over on Sunday. We did a press conference with the mayor and the CPS CEO and others, and there were all these kids getting their capes. We hand out the capes, for superheroes against the variant villains, and it was really, really nice to see the turnout there. But regardless, we have hit 69% of 12 to 17-year-olds have had a first dose. That's good. That's actually above the national average, but it is not enough, especially because when COVID is surging in the community, that's what makes it surge in schools. And then you can see the young kids, we're up to almost a quarter of them have had a first dose, and about 5% are done with their second, but data will continue to come in, including from the weekend there. Boosters look like this. We saw a drop-off in third doses or boosters over Thanksgiving, and we have not yet seen the increase I want to see. If you're hearing Omicron, if you're worried about the fact we're going back to high risk and you haven't had a booster, do it now. We have seen the best booster uptake among oldest Chicagoans, which is good. That's who I most want to see get a vaccine, but this is percents. And if you look at this, only 52% of Chicagoans over 80 have had a booster dose. That is not good. I need everybody, especially over 65, especially with underlying conditions, to get a booster shot. And you can see, if you look in the 18 to 29-year-olds, it's just 15% of them have had a booster. So really, message to everybody, now is the time to get it. We have vaccine available. And then if we look by race ethnicity, we're actually seeing Latinx adult Chicagoans lagging a little bit in booster doses, which is interesting because the uptake has actually been very good for adult Chicagoans for first and second doses. So we've been increasing messaging there, and we've seen about 38% of adult white Chicagoans get a booster, about 32% of Asian Chicagoans, 30% of Black Chicagoans, 21% of Latinx Chicagoans. So that's a little different than what we're seeing in terms of first doses. I've been pleased to see quite good. In comparison, obviously I would like to see all of these at the same level and all of them, well over 80% if I could get there, but I've been pleased to see good uptake among Black non-Latinx adults who have had the first and second doses, but there are many more Black non-Latinx Chicagoans who had never got their first or second dose. So this is only those who got their first and second dose and are due for a booster. So still, unfortunately, Black Chicagoans are the least protected overall. But we've got some work to do. I put this up every single time we do Facebook, but getting vaccinated now and getting boosted now in time for the holidays. For Christmas, that's December 11th. This Saturday is when you need to get a single dose of J&J, or if you're due for a booster, try to get it before Saturday so you're as protected as you can be ahead of Christmas, Kwanzaa, and then New Year's Eve. We're doing a lot vaccinating city employees with our end of the year deadline coming up. We've got a City Hall vaccine clinic today, 9 to 2. We're doing initial vaccine doses, boosters, flu shots. We gave hundreds and hundreds and hundreds of doses last time we did this, and that's been good. My last piece here is I just wanted to highlight, there was a new study that came out, and we got a couple of questions. This was a study from the CDC. It was in the MMWR, which is the Morbidity and Mortality Weekly Report. Chicago contributed data, and we had some authors on it from CDPH. And they looked at 6 U.S. Jurisdictions about how did we do with COVID vaccination in people who were experiencing homelessness compared to the general population. This is data from December 2020 when we started vaccinating up through August 2021. And really what you see here is in Chicago, as you may recall, this was a major priority for us. We prioritized eligibility and access for people experiencing homelessness. It was a major focus, tons of partners working on this, and I was really pleased to see the comparison here. What you see is that in the vaccination, we had 45% of people who were experiencing homelessness here in Chicago be fully vaccinated, and about 52% get a first dose. Now, that is not as good as the general population, right, where over that same time period, if 45% of people experiencing homelessness in Chicago were vaccinated, about 56% of the general population were vaccinated. But still, when you compare this across other cities here, where we're looking at Detroit or Fairfax County, Los Angeles, Hennepin County, Washington, D.C., where we managed to do 45%, if you look across here, the rest range from 18 to 35%. Not that this is a competition in any way, shape, or form, but I am really pleased, and there's a nice, written up about some of the work that was done here to build that trust, to build that connection, to bring vaccine to people, right? Like we've set up a lot more, not just in shelters, but for people in encampments, and it remains a priority, and I think one of the areas we've learned the most from in terms of how to do a better job making sure everybody in Chicago has access to resources. So I'll refer you to that article, but I just wanted to share the good news. And then obviously, as always, if you need a vaccine, if you need a booster, if you have a question, visit chi.gov/COVIDvax or call 312-746-4835. The mayor announced on Sunday we are expanding our at-home so that we will have it available 7 days a week. We're moving from some of the larger events to be able to have capacity to do that. Please, now's the time. Get online, find a vaccine, or give us a call. And I want to hand it to you just to do some CPS data, and then we'll jump into your questions.
Awesome. Thank you so much, Dr. Arwady. So for people who don't know me, I've done a lot of COVID work, and I'm really grateful to have this opportunity to speak with you today. So as Dr. Arwady called out for the city's data, kind of as the city goes, so does CPS when it comes to our trends. So we are experiencing that similar Thanksgiving surge, and I'm going to talk through the data on that shortly. What we also see is that we're paying really close attention to what we're looking for in-school transmission. Most of the cases we see are from the community, right? They're from those Thanksgiving events that Dr. Arwady talked about, from birthday parties or other social gatherings, especially now that the weather is getting colder. Many of those gatherings which were outside have now moved inside, and so we're experiencing kind of the after effects of those as well. For our schools, our big message continues to be very similar: get vaccinated. Sign up for our testing if you are unvaccinated. It's really important to leverage our weekly testing program. And then follow the travel advisory. We know there's a lot of travel happening here, both here, over the holidays, and then, winter break is going to be quickly upon us. Follow the travel advisory if you are unvaccinated. Please follow the testing protocols and stay home if you're sick. Once again, the biggest top line message for us. There's a lot of things that feel like COVID. The only way to know if it's COVID is to test. So on top of all of those, our regular protocols of masking, social distancing, we know are helping kind of contain and mitigate risk within our buildings. The new variant is something that, I'm always very grateful for Dr. Arwady to share more information about. So it's something that we are paying very close attention to and work with our city partners very frequently to talk about. I also, before I get into the data, just want to call out, have a conversation just about, we did have a loss of an employee at Carnegie Elementary, and really want to extend my personal condolences to the family and friends and colleagues of this employee. We know that Carnegie is going through a lot right now, and so we are really looking to leverage resources to support them, both around the employee loss, and then also they are having some COVID cases. So really leveraging our resources. We're sending out a vaccine event. We've increased testing, leveraging our partners at the Walder Grant. So working with the school, trying to make sure that they are both supported for what they need around a loss, providing grief counseling, but also, within a COVID response world. So just really wanted to share my condolences and let people know that this is something we pay really close attention to, and Dr. Arwady and her team we talk to regularly about any of these issues as they come up. So jumping into the data here, really just want to talk about our total case counts. As Dr. Arwady's graph had that big spike, so does ours. And this is not unexpected. This is something that we've been talking about with CDPH. This is not an unexpected outcome of Thanksgiving, especially in Chicago where it is so cold and all of our events are indoors. Just also want to call out that this is our weekly number of tests completed and our positive tests. And similarly to the city's data, we are seeing this increase in positivity from our tests. We are also seeing an increase in testing. So just to call out kind of the reason our graph is a little bumpy is we had a 3-day week, a 4-day week, a 2-day week, and then last week was our first 5-day week in a while. November is a challenging month for days off. So we're really trying to maximize testing wherever we can. We've seen increases in our total tests, week over week when we look at kind of the test per day. We are also seeing that increased test positivity here in CPS for our screening testing program. Not unexpected, talking with our hospital partners as well. They're seeing this as well. It's something we're paying really close attention to, but really trying to ramp up testing ahead of Christmas and then thinking about what this looks like after the winter break returns. And then just want to call out student staff vaccination stats here at CPS. I am really unbelievably excited that we've broken the 90% of fully vaccinated post 2 weeks of our staff. We know that there's still work to be done, but this is just a really exciting number for us, and I'm really, really proud of everyone who's pushed this effort to get our staff vaccinated. It's one of the best things we can do to keep our schools safe. You can see that, we're just around the 50% for 12 and up, and then similarly to the city's data, we're about 12% with at least one dose for 5 to 11, and we expect that number to continue to grow kind of as vaccine is more readily available. Want to call out a couple things. One is our Test to Stay program is always a hot topic.
And we've got a question about that so why don't you go ahead and start with that.
We'll start with the Test to Stay. So Test to Stay here at CPS, one of the things that we work really closely with Dr. Arwady and the CDPH team is looking at ways that we can be using best practice here at CPS. Test to Stay, Test to Return are all different forms that at the discretion of our local health department, we can leverage in a school setting. And so just Test to Stay is a process in which students and staff who'd otherwise be asked to quarantine are allowed to continue in person as long as they are testing every other day for a 7-day period. And there's a couple other qualifications, right? They can't play sports. We're trying to minimize their risk, really making sure that they're social distancing. This is something we've been talking about since actually last year when Lake County started doing the study with the CDC. So really trying to fold in these best practices. One of the recommendations in our conversations was to be really thoughtful about the school that we picked to pilot. And so we did start at a pilot school. So we're testing this week there. It is a school that's really vaccinated. And this was one of the recommendations from Dr. Arwady and her team, was to find a school that had a high vaccination rate. So this particular class that would have been impacted, almost all except 4 students were fully vaccinated. So 4 students would have been asked to quarantine. We spoke with all of their families. We sent out communications to the broader school community. All 4 students are participating. We're testing them every other day. This week, this is a first step. One of the feedback that we've gotten in the past is that, this is confusing. There's so many things changing. How do I know what the rules are? How do I know what the message is? And so that's one of the reasons we're starting very small, is so that we can hone that message, so that we can talk to parents and really get their feedback of what works for them, what doesn't work for them, what's clear, what's not clear, before rolling something out at a larger scale.
All right, good. So a couple other additional questions here. Don Wolf on Twitter actually says, full disclosure, the pilot school is ours. I'm not freaking out. Our kid is vaxxed. And he's asking, related to test to stay, sort of what's the rationale for this? Vaccinated kids don't have to quarantine. Why not give parents a choice? Get vaxxed or have to stay home?
I think that's a really valid call out.
Yeah.
I think Dr. already said it best at the press conference last week. It's not test to stay, it's vaccinate to stay.
That's right.
Not only is it catchy, but I think it's really accurate. This is something that we know is the best path forward for all of us. The really good news about our test to stay pilot is that some of those students were actually in the process of getting vaccinated, which is even more exciting. So that for us makes them a great candidate because they're on the path to being fully vaccinated.
That's right. And I would add here, of course, our goal is to have even full vaccination, have a vaccinate to stay. You're not even needing to have that. But when I look at the data here, of course, we are seeing a lot of variability in different schools related to, and what is the biggest predictor of whether a child is vaccinated? It's whether their parents are vaccinated or their guardians are vaccinated. And so in some of the same communities where we have been working the hardest to build adult vaccination rates, those are the same communities where we have to work even harder to have those conversations, build that trust, and have families make the decision to get the kids vaccinated. And so I do think, it is obviously very disruptive to children's education when they're in and out and half are in and all of this. And so our first goal is, of course, vaccinate. You've got a fully vaccinated classroom, and even if there is a case, as long as children are not developing symptoms, et cetera, nobody has to quarantine at all. But in the setting where that is just not the reality at the moment, we want to make sure we're doing everything we can to have education continue, but in a setting that is safe and doesn't drive outbreaks or further spread. And we're still learning about this, right? Like this is, but we felt like it was important to start with a pilot and expand from there. There's also Molly Fleck on Twitter on this. There's lots of interest in this. Is asking, when might you implement test to stay district-wide? Are there plans to differentiate? She's asking sort of the same thing, to differentiate between unvaccinated. I see. Sorry, it's 2 different questions. So I think district-wide, no decision. Can I just answer that? No decision at this point, right? Yeah. This is a pilot. We're working on it, and as we see what happens, when you are having a very large surge from COVID, if you are having concerns about a new variant, that may not be the time to expand it fully. But as we learn sort of operationally how to do this, we'll have more ability to do it. And again, if your child is vaccinated, they don't need to quarantine. She's also asking, are there plans to differentiate between unvaccinated children and adults under the CDPH's guidance for post-travel quarantine, which is also being used as the CPS policy, and it's causing healthy kids to stay home simply for traveling? And if you want to take that, and then I'll chime in too.
Yeah, so really we've tried to align our guidance consistently with the message put forth by CDPH as well as ISB, IDPH, and CDC. And that's really where our travel guidance comes from, is most tightly aligning with CDPH's messaging on travel. And we know kids can get COVID.
Yes.
And that's really... And do. And so, that was kind of an early conversation we had when the data wasn't there yet, is does this apply to kids? And we've seen the travel guidance get adjusted as we learn more. And so for us, aligning it with CDPH's practice allows us to be adaptive based on new information we learn.
Yeah, and there is not a plan. Obviously, not just CPS, but any school district and any business, and we have seen people use this travel policy in the way that makes sense in their setting. But it has done a lot, I will tell you, to drive vaccination. We have seen many businesses, for example, here in Chicago follow it, not be allowing their employees. The city of Chicago does not allow its employees to travel if they are not fully vaccinated, and there are, and the state is on the travel advisory. And I think it has helped. Each of these things helps. None of them is 100%, but I do not think it makes sense to differentiate between children and adults. What is the biggest risk factor for getting COVID right now? Not being vaccinated. It's not the kid's fault, quote unquote, that they are that they have not been vaccinated. But on the other hand, where COVID is surging, the risk is higher. And if unvaccinated people are traveling, we ask them to do that testing and to do that quarantine. It's part of what has kept us, even now where things are surging around us, it could be significantly worse, and it is significantly worse. So we are certainly in support of CPS's decision there. And again, we're just getting to the point where 5 to 11-year-olds are fully vaxxed and will be able to do that traveling. I understand it's still challenging for the younger ones, but that's been one of our policies, and it's unlikely to change.
Yeah, especially with winter break coming up.
Yeah.
We know that a lot of travel happens over those 2 weeks, and for our 5 to 11-year-olds, there is time for them to be fully vaccinated. And that's really an important message for us. Because when you travel, we're also seeing people, and you're in airports, and you're mixing in populations you're not normally in. So, travel in itself has risk, and then those specific localities with higher transmission, we know the risk is higher there.
Yep. Anthony Calabar from Twitter says, this is for you. There have been some reports of unvaccinated teachers showing up to work. He's thinking of a particular incident at a charter school. What is being done to prevent this? Maybe talk a little bit about what happens if there are still some staff who are not vaccinated.
Absolutely. So just to call out, our policies are district. Yep. Charters, while some charters operate under CPS, they do make their own policies. They have their own agreements. So they are slightly different policies and protocols, but all of us kind of roll up to CDPH in the broader recommendations as well as ISB. So here for district schools at CPS, there are some unvaccinated staff still, and they are following the governor's orders as part of the requirement for testing. So they participate in our weekly testing program here at CPS, and then we monitor that for compliance. So not quite sure, the specific charter situation, but part of all of our rules right now is dictated by ISB and the governor's orders.
Riley Scully on Facebook says, how does the PCR test between different variants of this virus? So good question, Riley. The PCR test that you get a result to does not differentiate between different variants of the virus. When you get a test, whether it is an antigen test, whether it is a PCR test, the answer that you get is yes, no, I have COVID, or I do not. But behind the scenes, this is where that sample that is collected for PCR can be collected and sent to a laboratory, like, for example, CDPH's new Regional Innovative Public Health Laboratory in partnership with Rush and others, where you do you literally are taking the genome, not of the person who had COVID, but of the virus itself. And it is that work that all over the world, since the beginning of COVID, worked to set up an international database that whenever anybody is taking the genome, taking the genetic fingerprint of the virus, all over the world, it's getting uploaded and shared right away. And so on an individual level, we don't treat you differently if you have a different variant, right? If you have to be hospitalized, you would still be hospitalized. The treatments that we have available are available regardless of what variant you have. We do the same thing for influenza. If you test positive for flu, in terms of treating you, giving you medications, et cetera, we just need to know you have the flu. But behind the scenes, public health does the work to understand which strains of the flu are circulating. We use that information to adjust the flu vaccine each year. That's why you have to get a flu vaccine every year. And so it's that sort of behind the scenes public health work that helps us know what's happening with how the enemy, the virus, is actually changing. And so I've shared repeatedly, and if you go on our website, you'll see we update regularly, everything we've been detecting, 99.9% of what we've been detecting in Chicago, in Illinois, across the U.S. has been the Delta variant for months and months now. But I do expect that we will start to see the Omicron variant be part of that, because it at least in South Africa, it quite quickly outcompeted the Delta variant. So I hope that helps clarify. And if you've got more questions, let us know. All right. Oh, here's just a quick one. Mary Kay from Facebook. My daughter took the J&J shot. She needs a booster. Is Moderna okay? Yes, assuming that your daughter is 18 or over, because remember, boosters are available for age 18. No matter which vaccine people got, they can get a booster with any of the other vaccines. Specifically, if someone got J&J, it's the only one that I've seen data that I actually recommend, if possible. If you got J&J as your first dose, I would get Pfizer or Moderna, either one, as your booster dose. We just saw slightly better levels of protection. Other than that, I would stick to the same vaccine. And if you felt strongly about getting, I saw someone in clinic last night. I was talking to her, she'd gotten her Johnson & Johnson vaccine. She felt really strongly. She hadn't had side effects. She was like, I want the same one. I said, great, like get the same one then, but get a booster. And so, yes, absolutely, Moderna is not only okay, but good to get. All right, let's see if we've got some more school ones here. So Kathy Powers on Facebook is asking, why aren't schools being shut down? She's wondering about, we're seeing, I'll just read the question and then address it. She says, why aren't schools being shut down due to so much infection, deaths, inadequate supplies, testing, spacing, knockoff HEPA filters being used sometimes? There is significant health risk. Why do you say they're safe? So if you want to start on that, and then I'll add it in.
Yeah, so schools are safe, and we have the data that says this. You know, we're paying really close attention for in-school transmission, right? When people can get COVID from the school setting. Now, when it's likely. There's no guarantees, because we're not doing that genetic testing that Dr. Ardy was talking about. We'll never know exactly where someone got COVID from, but we can kind of work through the public health apparatus, do interviews, figure out kind of where we think this likely occurred. Most of our cases occur from the community. So it's household exposures, it's travel related. And so there's a lot of things that we are doing. We do have HEPA filters in our classrooms, but we also have mechanical ventilation. You know, we have hand sanitizer available. We have an abundance of masks and PPE available. If there are schools that are having shortages of supplies, please reach out to, you know, call 773-553-KIDS. We can help direct you to the, you know, to the resource, connect you with what we need. We have supplies in our warehouse. We've ordered enough to support our schools. We have disposable masks for our students who you know, forget theirs. We have a lot of supplies available, so please reach out if your school's experiencing something, and this way we can escalate it to the appropriate venue and get these resolved. The other thing is, you know, we are continuing to scale up testing. We only test those who are consented. So really kind of looking at that. We're also looking at some other creative solutions. You know, you talked about at-home testing. That's something we're looking to help schools have another option to provide to families for testing, that they could just take a PCR kit home with them and drop it in the mail. So really trying to think through some creative solutions to create more resources for our schools. That, you know, we know that testing isn't always easily accessible, right? Or convenient for some families. And so we're trying to think through some creative solutions to support that work.
Yeah, and I would just add, the schools are actually one of the settings that have had by far the most investments in terms of ventilation, whether that's HEPA filters or others, again, not just CPS, but the federal government put aside millions of dollars to work on this, recognizing that a safe school, not just for COVID, but long-term, having good ventilation, healthy structural things within schools is important. And so even before CPS reopened, you know, there were industrial hygienists, certified industrial hygienists in every classroom sort of doing the testing. If there were ones that weren't meeting standards, working on it. It actually, you know, I know there's a lot of conversation out there, but in terms of that ventilation piece, I worry a whole lot more about actually non-school settings than I do school settings, knowing that that's something that at least here in Chicago has been addressed quite well. And I would say, you know, I just want to push back a little bit on this sort of, what, you know, we're seeing a lot of infection, a lot of deaths. We are, but we're not seeing that in schools or disproportionately in schools, where obviously whenever anybody dies from COVID, that is a tragedy. It is a double tragedy if somebody, you know, there's spread or somebody's not vaccinated, and you know, my heart really goes out. Every single day, my team is talking to people who are diagnosed. We continue to call everybody who's diagnosed with COVID in the city, and that is hard work. And then especially, you know, I've got team members who have family members, some of whom aren't vaccinated, you know, who are getting really sick and who are dying, and we're having more breakthrough infections too, and that's a worry for people, of course. But what we have seen over and over again, not just in Chicago, but across the country, is that where we take COVID seriously, it's not where we see the big problems. And schools, we had this example to do sort of a natural experiment, if you were, where we had thousands of children in school and thousands of children not in school last year. And we saw lower rates of COVID among both staff and children for the ones who were in school. And I am always going to go based on the data. It's part of why I've been such an advocate. Certainly, if there is a given setting within a school, if there is a major outbreak, if there's something where protocols are not being followed and there's been spread, that is when we are working. Some of you are asking, you know, what flags a school to be closed? That's exactly the kind of thing that we're looking at. Are we seeing spread within? Have there been outbreaks? We investigate them when there are, but we're not seeing these massive, widespread, large-scale outbreaks that you tend to read about or people assume that are happening. You know, I remain really confident that the schools are in a place where they can remain in person, but we all have to double down on the things that have gotten us this far. All right, we are just about coming up on time. I'm going to hit a couple just really quick here. Alexandria Deanne on Facebook is asking, if I've got family members who aren't vaxxed yet but are considering it now with Omicron, which vaccine would you recommend as being the best one? Is one performing better than others? We don't know yet. That'll be some of the data that we have in the next couple of months. But the clearest answer is the big difference is not which vaccine, it's vaccinated or not vaccinated. So I hope if there are people who've been waiting but are now worried with Omicron, you know, now definitely is the time, and we'll share that if that's more. And then just the last thing here, Rachel Sachs on Facebook is asking, can you share more about what Chicago's doing to increase access to at-home tests? Are CDPH, is CPS getting testing out? We are, and we're a little bit at time, but I will take that question, and the next time we're back on Thursday, we will talk a little more detail about some of what's happening in the testing space. And of course, there's a lot happening that folks may not be aware of. So thank you, everybody, for your questions. Thank you. Dr. Ali Santag is a nurse practitioner, really doing a lot of the behind-the-scenes planning and work and decision-making at CPS. Anything that you wanted to just add, just to wrap up? Or
I'm just grateful for this opportunity. I think one of the things that with evolving guidance, right, it's really easy to get overwhelmed.
Yeah.
That things are constantly changing, and in schools, we like regularity.
Yes.
We like things to follow a set of rules, and COVID doesn't follow the rules. You know, once we get set with one thing, we get a variant. You know, the guidance is constantly evolving, and so, you know, I really appreciate CDPH's partnership to make sure that, you know, we're following best practices, but then also creating opportunities like this for us to answer questions, because guidance does change and evolve, and especially with a virus that's changing like COVID is. Yeah. The only way to do this is to be nimble and flexible. Yeah. And in a district of our size, it's hard. Yeah. And so just really appreciate your and your team partnership on this work.
Yeah, likewise. Thank you for that. Yeah, it's been good to see schools across Chicago really come at this from all angles. It's not just about, can I make vaccine available? It's how do I have those communications, build that trust, and I do think schools continue to be one of the most important partners there. So thank you again for the questions. We will be back on Thursday. I'll hit a couple of these things we maybe didn't get time to. And we are also planning to have Nick Prashand, who is the Director of Epidemiology at the Health Department, talking in some more detail about some of the behind-the-scenes data, as well as some of the ways we're taking the lessons from COVID data and applying them for other public health issues across Chicago. So if you're able to, come back Thursday at 11. In the meantime, Keep talking about vaccine. Please try to get a booster. Talk to anybody you know who hasn't had one, and have a safe day. Thanks.